Assalamualaikum warahmatullahi wabarakatuh and good day everyone. So in this video, we will be presenting on artifacts and contaminants, identifying and mitigating diagnostic pitfalls. These are common findings encountered during microscopy examination and can significantly affect the accuracy of laboratory diagnosis if they are not properly recognized. Artifacts are artificial alteration or distortion of tissues, cells, or image that occur during specimen collection, preparation, or even processing. These changes are introduced by the testing procedure itself and do not represent the patient's actual biological condition. On the other hand, contaminants are foreign material that enter the specimen from external sources such as the environment, medical instrument, or even the patient itself. They may obscure tissue structures or mimic bacteria and other pathogens, which can lead to misinterpretation. Therefore, distinguish artifact and contaminants is important to ensure accurate microscopy examination and reliable laboratory diagnosis.
First, let's discuss air drying artifact. Air drying artifact is a fixation artifact caused by delay wet fixation after smear preparation. Water evaporation before fixation leads to cytomorphological alterations. The main changes involve the nucleus and cytoplasm, including nuclear enlargement, pale nucleus, indistinct chromatin details, and reduced differential cytoplasmic staining. These changes may mask or mimic cytological atypia, making accurate classification and grading of epithelial lesions more challenging. To prevent this artifact, immediate fixation using 95% of ethanol or fixative spray is required. For smears that have been air-dried for less than 2 hours, rehydration using normal saline may help to restore staining quality and improve visualization of cytological features. Next is Ferning artifacts. Ferning is a microscopic organization of sodium chloride into geometric fern-like crystal formed by dried cervical mucus. It is commonly seen during high estrogen state such as around ovulation or pregnancy. It is more frequently seen in conventional pap smears because mucus is retained during preparation. When ferning is abundant, it may obscure epithelial cells, reduce cytological clarity, and potentially mask atypical features, creating difficulties in interpretation. To minimize this effect, excess mucus should be reduced before sampling, and liquid-based cytology (LBC) can be used to reduce mucus-related obscuration.
Move on to the next artifact, which is Cod-Liver artifact. Cod-Liver artifact is a non-microbial organic cellular aggregation formerly known as a pseudo-actinomycetic radiate array. It's surrounded by a distinctive outer ring or halo like of histocyte. The pre-analytical error of this artifact is it's caused by the patient body condition when women have a high progesterone level. For example, pregnancy women after delivery, breastfeeding, or oral contraceptive use. The diagnostic pitfall, this artifact can mimic with actinomyces, the morphology like the presence of filamentous surrounding inflammatory cell and cannonball, and is commonly associated with long-term IUD use and pelvic inflammatory disease. What can we prevent to avoid this artifact? First, we need to review patient history. Second, feed the slide immediately in 95% alcohol to avoid air drying artifact. Third, differentiate by structure like artifact has plain spike while actinomyces have fine branched filamentous. And lastly, we should use gram or GMS stain to confirm the diagnosis. The next artifact is worm-like artifact. Worm-like artifact is an elongated thread-like structure on a cytology smear that mimic a worm but is caused by contamination rather than disease. The pre-analytical error this artifact is occurred during sample collection, slide preparation, staining or mounting. The fiber from cotton swab, gauze, tissue paper or laboratory material became attached to this smear. The diagnostic pitfall is it can be mistaken for parasitic worm, which is helminth parasite, and then can be confused with fungal, hyphae or filamentous bacteria. The lastly may obscure important cellular details, making it interpret difficult. The prevention is we need to use clean, link-free slide and laboratory material, avoid using cotton fiber or tissue paper near the prepared slide, and lastly, we should keep staining solution and work areas clean and free from contaminants.
Moving on, carpet beetle larvae. What is actually carpet beetle larvae artifact? It is a common household pest that feed on organic materials such as wool, silk, feathers, and cotton. During specimen preparation, these larvae might enter the sample through airborne dust. These larvae mimic fungal infection, especially Candida species. Their bodies covered by tiny hair-like structure called hesticitae, which resemble hyphae. This may also be introduced through contaminated cotton swab, spatula, or sanitary pads. The pre-analytical error is improper storage of slide and collection device or poor environmental cleanliness before lab analysis. To prevent this, laboratories should keep the specimen collection and slide preparation area clean and ensure to store collection device in clean and covered container. Move to splat smear. Splat smear occurs when the specimen is expelled onto the slide without spreading properly, resulting in multiple thick droplet splat. This usually happens due to poor slide preparation, which is rough spreading technique, or when spray fixative too close to slide. This splat smear making large lymphocyte, for example, neoplastic in lymphoma, can be misidentified as small lymphocyte due to the cell difficult to identify. As for the prevention, the first one is gentle rolling technique. Number 2, consider of using liquid-based method. And lastly, spray fixative, maintain an appropriate distance, which is 20 to 30 centimeters.
Next is the conflict artifact. A conflict artifact is a processing artifact. This artifact can be caused by poor dehydration before mounting or the drying of xylene, when the specimen is not adequately dehydrated before staining, and then the cell develop a brown flaky appearance. A major diagnostic pitfall is that the conflicting artifact can mimic glycogenated squamous cell because both can have pale cytoplasm, but the difference is that glycogenated cells appear to have smooth, well-preserved cytoplasm with a shiny rim due to glycogen, while cells affected by the conflict artifact show wrinkled and cracked cytoplasm. To prevent this artifact, it is important to ensure that slides are properly dehydrated and correctly mounted, which also help prevent the formation of air bubbles during slide preparation.
Now let's move on to fungal contamination. Fungal contamination occurs when non-pathogenic fungi, which are harmless fungi from the environment, accidentally enter the cervical smear during sample collection or laboratory processing. This is important because their presence does not mean the patient has a fungal infection. The challenge is that these fungi can look very similar to Candida under the microscope. Some fungal spores may irreversibly parasite or other abnormal structure. As a result, they can cause a false positive diagnosis where the contamination is mistaken for a real infection. This contamination is usually caused by non-sterile collection instrument, contaminated collection material, or delayed fixation, which allow environmental fungi to contaminate the specimen. To reduce this problem, healthcare workers should always use sterile equipment, fix the smear immediately after collection, and maintain aseptic technique throughout the sampling process. Next is a spermatozoa contamination. Sperm cell can sometimes be seen as cervical smear when the patient has sexual intercourse within the previous 24 to 48 hours. This is considered a normal contamination and is not a disease. However, sperm can create diagnostic challenge. This head of the sperm may look similar to candida spore, while the entire sperm cell can sometimes resemble the parasite Trichomonas vaginalis. If many sperm cells are present, they may also cover the cervical epithelial cell, making it more difficult for the cytologist to examine the sample accurately. To prevent this type of contamination, patients are advised to avoid sexual intercourse, dodging and vaginal medication for at least 48 hours before a pap smear. Following this instruction help produce a cleaner specimen and improve the accuracy of the test.
Moving on to the glove powder. It is a modified starch powder applied to gloves to make it easier to wear. This contamination usually occurs during specimen collection and slide preparation. For example, powder may be released when changing powder glove near the specimen, or it may be transferred onto the collecting device before sample collection. Glove powder particle may create diagnostic pitfall because they can mimic epithelial cell, parasite ova, and fungal yeast. They appear as polygonal refractory particles with a characteristic central dark striation. To prevent glove powder contamination, switch to powder-free glove during specimen and handling. Proper smear preparation should always be followed to minimize contamination.
Next is a fiber contaminant found in the gynecological smear. Fiber are foreign materials that are accidentally introduced into the smear from the external sources during the sample collection, preparation, or handling. Common examples include cotton fibers from swabs, tampon fibers, hair fibers, and paper fibers. These contaminants are usually related to the pre-analytical errors, such as the use of the contaminated collection materials, dirty instrument, or leaving slides uncovered before the fixation. Although fibers are not biological structures, can create diagnostic challenges because their appearance may resemble fungal hyphae or parasitic structures. This may lead to the misinterpretation and unnecessary further investigation. To differentiate fibers from true microorganisms, several features can be observed. For example, cotton fiber usually have a uniform width with frayed or twisted ends, and they do not show budding yeast or inflammatory background. In contrast, fungal structures such as Candida pseudohyphae usually show variable width, section with constriction and budding yeast form, often associated with an inflammatory response. Therefore, proper slide handling, using appropriate collection devices, maintaining a clean environment, and immediate fixation are important steps to prevent fibers contamination. Another common exogenous contaminant is dust. Dust refers to airborne particulate matters that deposit onto the smear during the preparation, storage, or examination. It can originate from the laboratory environment, especially when the slides are left uncovered or when the workspace is not properly maintained. Dust contamination may become a diagnostic pitfall because some particles can mimic fungal spores or microorganisms. In addition, excessive dust particles may obscure important cellular features, reducing the quality of the microscopic evaluation. To distinguish dust from the true biological structures, we can observe several characteristics. Dust usually appears as irregularly shaped particles that are randomly scattered with variable staining patterns. It does not have organized biological structures. On the other hand, microorganisms such as actinomyces or fungal elements show more organized features, including filamentous structures, branching patterns, consistent staining characteristics. Therefore, prevention of dust contamination requires proper laboratory cleanliness, covering slide properly, and appropriate slide storage condition.
Lubricant gel is a watery-based substance applied to the speculum during sample collection. If it is used too much, it can be introduced into the specimen during collection, making it a pre-analytical error. The main diagnostic pitfall is that lubricant gel may mimic mucin, proteinaceous material, and even trap or obscure important diagnostic cells. To prevent this, healthcare professionals should follow standard specimen collection protocol and use only the minimum amount of lubricant necessary. Lastly, diatoms. Diatoms are microscopic algae with silica-containing cell walls commonly found in aquatic environment. They may contaminate cytology specimens through contaminated water, reagents, or environmental exposure. The diagnostic pitfall is that diatoms can be mistaken for parasites or microorganisms and in some cases may resemble abnormal epithelial cells. To prevent contamination, laboratories should maintain proper quality control by using clean water, fresh reagents, and ensuring that laboratory equipment is properly cleaned.
In conclusion, distinguishing contaminants from the true microorganism is an important step in gynecological cytology. Careful evaluation of morphological characteristics, together with proper specimen collection and slide handling, help prevent false positive diagnosis and ensure reliable cytological reporting.